Awesome.
too.
Thank
Yes,
you. Thank
yes,
you.
yes.
I truly appreciate that, because often, just often my category is left out
Yeah.
of a lot of conversations. And more and more, and really over the past, I'm going to say the past almost 2 years, really in the past year, if you guys have paid attention, it's like menopause has been like the buzzword, right?
Yeah.
And so that is interesting because, of course, when you look back at even when I met both of you guys, that was what, 3 years ago.
Yep.
Mhm.
And it was still kind of not really being talked about. And so I find it interesting how just these buzzword things happen, even though women have been complaining, suffering, looking for more information, trying to get
Mhm.
educated on things, and it has just kind of been swept under the rug or not worthy of being talked about on major platforms, on health panels and all of those things. And so I made a decision just probably about 7 months ago that I was no longer gonna just keep beating my head against the wall to try to get people to understand why these conversations are important. I said I'm
Mhm.
just gonna start creating my own programming. I am very well versed in doing so, and I can do it. And that's what I'm just gonna have to do. Just provide my own programming, my own wellness events, my own wellness panels, and invite the people who I believe deserve to be on the platforms, because we're really out here doing the work and we don't really have to wait on anyone to accept what our messaging is or accept that we have knowledge in particular areas, or accept that they're not ready for certain conversations that we're ready to start having with women.
That's exactly
I
right. I mean, I applaud you for that because
Yeah.
you are absolutely right. Like I say over and over again, menopause, when I enter into this arena, um, by way of having the surgery, that was in 2020. And the reason
Hmm.
why I started Pretty Moody and a Pretty Moody Foundation was because of what you just said. There was such a void. We were not having
Yes.
the conversations,
Yes.
like this taboo. And then it
Mhm.
became like it was like a click. And then everybody started talking about menopause, and it seemed like it happened overnight.
Mhm.
Like,
Yeah.
and I
Mhm.
just want to also come in here and say we have definitely segued right into this podcast.
Yes. Yes.
Definitely.
I am really, I love that these conversations are beginning to happen. And I don't think it's by chance that these conversations just appeared out of nowhere. I think that what also is happening is we are learning more and more how pharmaceutical drugs are um causing havoc on our body. It's
Yeah.
meant for one thing, but then there's information that comes out later on about what it is doing. And specifically to women of color, we aren't necessarily the ones who are willingly going to the trials to say, okay, we want to try this out to see how it works with our body makeup. And
Right.
so that's another thing that puts us at the disadvantage, because then we're the ones who are taking medicine or being prescribed medicine, or overly being told that we have to have uterus removal surgeries. It's all of these things that happen that put us at the disadvantage, and we have begun to talk about it in a way that our moms and our grandmothers and great grandmothers have never discussed it. It was
That's,
just never on the table for just in family makeups. It just was something that was just never discussed.
that's exactly right. I just graduated last night from my civics engagement class with the Delaware Coalition of 100 Black Women.
Congratulations.
Thank
Yeah.
you. Thank
Congrats.
you. And the whole backbone of that is to help us get elevated in the realm of advocacy for whatever it is that we're standing
Hmm.
in.
Mhm.
And it's so true. Like there's so many health disparities, especially as it pertains to Black women and women of color. And us being not included in the data that's been collected, it definitely affects, us and what we're prescribed, what we're told, like everything. I don't know if you're aware, but I just completed I went in, I'm saying completed, did it myself, but I've been working with a scientist over the last 2 years together, collabing on a menopause study so that we can collect the vital information that's
Awesome.
it for us to be a part. And of course, it's for all women, but the focus is on Black women and women of color for me because I am a Black woman and woman of color. And I
Yeah.
want to make sure that we are, being recognized and that we are being included, in the data that's being collected so that we can change the trajectory of how we are being prescribed things in the future, the information that we're given. We can't
Mhm.
keep being absent and just being everybody treated the same in this one
That's
big
correct.
melting pot because none of us are the same, right? But if
Mhm.
they're not really looking at our genetic makeup, and the social determinants of health and things that we
Mhm. Mhm.
communities, then we're never going to really get the care and attention that we need. So I encourage every woman to go online to prettymoody.com, take that survey. It's under menopause study. I'm sorry, because we wanted to do way more than calling it a survey.
Mhm.
And it's been distributed all over the world. The scientist, Dr. Liebman, he's been phenomenal. And he's been working with Canada. He's been working in the UK. I mean, really like all over India. He's everywhere. So we're trying to really get this study like out, all over the world again, so that we can have a greater impact in this women's health sector. Dr. Victoria,
One thing,
yes.
one thing I do want to say about that is like I am so happy that menopause is getting the recognition it deserves because it does deserve it and people need to get help for it and the right help. But the problem that I'm seeing too is other people with more ill intentions are coming onto it and promoting these products and stuff that aren't right and like just to make money off of the buzzword. So
Mhm.
like I'm
I
so
see it
glad.
too.
It's awful. And I'm so glad like people like us are out there like telling people the truth and like have genuine intentions of getting people better and getting people the healthcare they need. Like I'm definitely seeing an uptick in people getting help for menopause or perimenopause.
Yes.
Really. They're
Mhm.
noticing like frozen joints. Like people are coming in with
Yes.
frozen shoulders and
Yes.
hips.
Yep.
And then, of course, like the changes that happen in the muscles, like the pelvic floor gets weak, dry because of that estrogen drop, or one of the three reproductive hormones is off, either progesterone, estrogen, testosterone. Like people are knowing to go get like assessed, like their hormones assessed and figuring
Mhm.
out what natural ways you can get help. Like Nakea is more of that natural herbal um, like part of all of this, which is
Mhm.
amazing.
Mhm.
Because not everyone's comfortable getting that vaginal suppository of estrogen. So there's great like alternatives out there.
It really
There really is. And thank you for even recognizing the holistic side of things. Just this week on Monday, I founded a traveling spa club, and we were at a spa, and we just happened to be sitting around a table, and maybe it was six of us, and four of the women were all complaining about the same hip issue.
Oh,
The same hip issue. And I have noticed that I have had, a hip issue too, but I was contributing it to a back situation that I had a few years ago that I
mhm,
started kind of overcompensating on my right side.
mhm,
And we were both all talk I mean, we had this intense conversation, okay, about this hip pain. And I was saying to them about the whole perimenopause phase and how this is contributing to this, but all of them said, "Oh, my sciatica."
Yep.
But it
mhm.
actually isn't sciatica.
Right.
Right.
It isn't. and actually, what's interesting is one of the ladies that was with us, I had sent her to my physical therapist, massage therapist, uh, physical therapy massage therapist, and she pretty much told someone who kept saying, "Oh, the doctor's saying it's sciatica, it's sciatica." The whole time, it's bursitis.
Ah,
It's bursitis, and part of that, it's like not only that frozen situation,
yeah.
but the way when we have one frozen side, we're overcompensating on the other side and trying just to get comfortable. We're creating a problem with that bursa.
Yeah.
That's right.
And you want to know like how else that's happening too? So the pelvic floor, like I said, is getting weaker too, just by
Hmm.
hormonal changes. And when that happens, like everything kind of shifts around and like your weaknesses in your hip and in your lumbar spine show up a lot brighter.
Hmm.
So then you're feeling like that sciatic, that bursitis, like everything's kind of like blaring at you now, like it,
Hmm.
the weaknesses. So that's also happening too, along
Yeah.
with like joint changes. Cause like the frozenness of the joint, like the synovial fluid changes with the hormone changes.
Hmm.
It's crazy.
and
I
and
was
I've
going to
dealt
ask
with the
you.
shoulder, and the hip issue, and I'm talking about in a group of 6 women, 4 of them were
Yeah.
describing this same exact thing. Then we also start to talk about, oh, just our changes, other changes in our body. So some of them were talking about how the vaginal dryness is affecting them. And so we had a whole conversation about that, like treating it more so from the inside out versus
Mm,
a topical situation.
yeah.
Also, what was discovered is that through this peri phase, and some of the women are married, some of them weren't married, or in a relationship at all. So even like a decrease in intercourse was being talked about, because even what I noticed with myself at this age, it's like even though I have a partner, I feel as though I am having less intercourse, right?
Yeah.
And I notice how my body has changed as a result of it.
Right.
And my own pelvic floor weakness, I'm seeing that the everyday feeling of kind of heaviness that I feel as things are shifting around, it's like, oh no, wait a minute, I got to get on some kind of schedule for regular intercourse, because when I
Yeah.
was way more active, I did not have any of these issues.
Right. They
When your back and your hip hurt, you don't want to, and your vagina's drier, like you don't want to even like
had
think
a
about it.
desire. Yes,
And
you
like
may.
those hormones like affect your libido too. Go ahead, Cheryl.
Mhm.
Sorry to cut
Mhm.
off.
Yeah, no, no, you're fine. I was going to say, the same thing. Like number one, I want to backtrack and go back to Nakea mentioning the perimenopause. Like a lot of women are number one, they don't even know that they're in perimenopause because they're thinking that you have to be this certain older age or whatever. And perimenopause can very much so start in your 30s.
Yeah,
A
you can be in
lot
it
of
for like
women.
10 years.
Exactly. And a lot of
Mhm.
women are experiencing these symptoms and they're going to their healthcare providers. And let me just say a disclaimer, I am not a doctor at all, and everything that I am telling you is for educational purposes only. But when you go to your doctor, a lot of times they really are not well versed in perimenopause or menopause. So when
Mhm.
they have misdiagnosed, and that's why they're saying, oh, you got sciatica, or oh, you got this, or oh, you have arthritis. And sometimes
Or you have anxiety, or you
that's
have
right.
anxiety
That's right.
when really what you have is a perimenopause induced ADHD,
Yes.
that brain fog and that ADHD is being misdiagnosed as
Right.
anxiety, and now you find yourself being pushed a prescription
Yeah.
that's a anti-anxiety medicine or
Right.
antidepressant,
Right.
just because of that. Like, I can't, perimenopause has taken my ability to read fiction away.
Yeah.
I
Mhm.
cannot, and it's one of my favorite things to do is to read fiction
Wow.
books. I cannot. I
Wow.
literally can't. The brain fog is so bad that I cannot, and the ADHD part is so bad, I cannot sit and even dive in to the whole plot situation.
Right.
And for nonfiction, what I've had to do is just do audiobooks. And
Mm.
it is hurtful to me because it's one of my favorite things to do. But I'm like, until I get this fully under control, I have to do it this way just to continue to, feed my mind and still do a pastime that I love.
Well,
Yeah.
that's what it's all about too. And let me say this, anxiety is a menopause symptom also. There's almost, and actually I found over 100 symptoms, and I get challenged on this all the time. But you can also find those on my website because I've broken them down as to how they're compartmentalized as to how they affect us in our bodies, like the psychological, the physical, like all of it. But anxiety is definitely a symptom. But yes, there is such a thing too as that ADHD that's heightened. And I believe that it just comes with layers of things. Like one thing like kind of leads to another. And that's why it's important that we are very much so in tune with what's changing in our bodies. Like you
Hmm.
you said a couple of things, Nakia. You said, you noticed that your sex is not up like it used to be. So that's causing changes in your body. And we hear like if you don't use it, you lose it. We hear that in a general,
Hmm. Hmm.
that applies to pretty much every area in our body, right? Every muscle, Dr.
Muscle atrophy
Or
is
you can
real.
speak to that.
Hmm.
You know what I mean? And
Hmm.
the pelvic floor is a muscle.
Hmm.
Oh yeah.
So I mean, it's so much to like unpack there. But and the other thing that you said too is something that you love to do, you're finding that it's not easy for you to do anymore. And that happens in this stage of our life a lot. There are things that, we just did with no problem. Like it would just come to us and so natural. And now it's a challenge. But again, the important thing is number one, that you identify it, that you realize it, and that you made the adjustments that work for you. And that's what it's all about, finding the best way to have the best quality of life for you on this journey because it's going to be ever evolving. Dr. Victoria, can you speak to the changes that happens in our pelvic floor, perimenopause and menopause? Because I mean, you and I done talked about this several times. Like I came to see you. We did the exam. You were just so amazing with the attention and listening. I mean, someone showing up and being present and just hearing you is so important. And I mean, you just do it like you, because it's you. So it's not, you're not even thinking about it. This is who you are. But the attention that you gave me, the information that you gave me was just like amazing. It was bar none. So can you please share like how our pelvic floor is affected in this phase of our life?
Definitely. So thank you very much for that. Um, so what happens is your estrogen drops, and then progesterone and testosterone can be off too, depending on the person. But what happens as a result? Your muscles get weaker, and like we think of a nice plump pink muscle, right? Of anywhere in the body, but particularly the pelvic floor. That's what it should look like. It becomes thinner and drier. So like you're not getting that lubrication from the estrogen. Um, so what happens is your hip starts to compensate, your starts to compensate, knees even, like Nakia was talking about earlier. And so it just snowballs into like all these orthopedic problems. You're not able to have intercourse or use a tampon as comfortably because things are dry. And then, of course, you have to think about your bone health and your heart health. So, like, estrogen is a protector of both of those things. So, bone density can drop a little bit. Your cardiovascular health is a little more vulnerable. So, it's important that people are at the very least like going out for walks, getting that weight bearing exercise, keeping their heart healthy. But I'm also a big fan, like the cornerstone of my business is getting people strong. So like if you are doing a consistent weight training program, that is going to help you immensely through perimenopause and menopause because your hips are strong. If you come to pelvic floor PT and learn how to wrangle in the pelvic floor with that, you're going to be so much better off than if you weren't able to do anything. Um, And then, of course, like there are other things that I keep learning more and more about menopause every week, I swear. Um, so, like, of course, getting evaluated, like Sherelle said, in physical therapy, like getting assessed in your back, your hips, pelvic floor, figuring out exactly what you need personally. But also, there are other types of things out there. Like, I learned from an MD recently that they're doing like PRP injections. Are you too familiar with those?
I am now because you told
Because
me.
I don't. So they basically draw your blood from one area, run it through a centrifuge, and inject it into the pelvic floor to help that healing process and that plumpness come back. There's also like a micro needling technique too, where it's very, very like small needles. They do the same thing and create like that healing process, which is another holistic way. Um,
I have a client who had that done, and we had a conversation about it just in the past few weeks.
yeah,
But she had it done for another part of her body. And she basically was saying that it wasn't covered under insurance,
that's the problem.
but
Yeah.
that she was in so much pain that she didn't want to have surgery. The surgery would have been covered under her insurance, this
Mhm.
whatever surgery her doctor was suggesting. So this was another suggestion, and she said she took out a line of credit to be able to get it done. And she said it took a few months before she saw like a difference, but now it's like a world of difference.
Yeah. It's so effective. But that is the issue is like these new treatments coming out aren't covered by insurance. However, like physical therapy can help. I want Nakea to speak on what she does because like the herbalistic type of approach can help as well. And she can speak on that much better than me.
Thank
Yes.
you.
Yeah, so let me tell the audience that Pretty Moody, because we just this conversation started off like boom, because we have like some wonderful information to, give the community. But Nakea is the founder and owner of Vtox Body in Philadelphia. And please tell us what you do to help the ladies with all the things we got going on down there.
Well, I am the principal Vagician over at Vtox Intimate Health and Wellness.
Love
And
it.
the service that we specialize in is vaginal steaming. In some cultures, it is called a hip bath. In other cultures, it is called a yoni steam. In other cultures, it is called a variety of different names. And so, one of the things that I want to share about vaginal steaming is that it can be used for so many things because the herbs are what powers the treatment. So the steam itself is just a delivery system. And I think that that is where there's a lot of confusion as far as how this practice helps people. And it's basically a delivery system to introduce the medicinal properties of herbs into your bloodstream at a rapid rate. So if people look at it from that standpoint, that, oh, okay, this is just how I introduce herbs into my body quickly, then it's usually less confusing that way. Because as soon as people hear vaginas and they hear steam, they're thinking, oh my God, I'm going to get burned, or this is going to happen, or that is going to happen. My pH is going to be compromised. None of those things will happen if it is done properly and if the right herbs are used for what you need them for. So for menopause, I do have a lot of women that come in with menopause related symptoms that they're steaming for. And one of the top things is dryness. Vaginal dryness has been, for the past 7 years that I've had our location, it has been the top of the list. And so the first thing usually that I recommend is hydration, to make sure that you are drinking the appropriate amount of water daily. Second, if the hydration doesn't help, then at that point we can use the help of mucilage herbs. And so some of them would be slippery elm or marshmallow root. Those are things that are going to help your mucous membranes produce the way that they are supposed to produce. For hormone balancing, for my ladies who are dealing with um, any type of PMSy symptoms, or even with the anxiety, or dealing with the hot flashes, dealing with mood swings, there are herbs that can easily be used, whether you're using it as a steam, whether you're using it as a tincture, or using it to drink as a tea. Those are things like red clover blossom, sage, even can help to cool the body down and help to stop the hot flashes. Also, for our ladies who feel overly anxious, things like a lemon balm or a damiana, those are herbs that will be able to help calm down the nervous system some. These are things that are easily accessible. They don't necessarily have to have a certain credential to get those things, but it would be beneficial for them to work with an herbalist just so that they understand the dosage and how often they should be using these particular things. But vaginal steaming has been used for centuries for all types of reproductive health um, issues and as preventative treatment,
Mhm.
to help you not have to experience certain things. And in some cultures, this is started, as soon as the menstrual cycle has been regulated, and even young girls, just to make sure that their body is staying healthy. Um, Often, the young ladies that are coming into my office, it is not necessarily preventative so much. A lot of the teens and tweens that come into my office, they are full blown having major menstruation issues, whether that is very heavy bleeding, painful cramping, clotting, those types of things. And even my adult women too. But one of the reasons why I started this business was because of my bout with chronic infection and my daughter's bout with heavy, terrible periods. And the only thing that was consistently being prescribed to us were antibiotics. And they wanted to put my daughter on birth control, which I was against. And I
Mhm.
began to learn more about herbal medicine through a great friend of mine and the practice of vaginal steaming. She taught me everything that I needed to know to get started. And before this was a business, I really did this to help me and my daughter, which both of us were dealing with different things, but we both got amazing results. That led me to wanting to learn even more about herbal medicine, because in this practice, we just kind of deal with what herbs are typically used for reproductive health. But it led me to just go down this whole rabbit hole, really to learn more and more. And this is a forever learning business. When you're working in herbal medicine, you just don't learn one thing and then you're just the expert. It's a lifetime of learning, because there's so many herbs from around the world that help with a variety of things.
Yeah.
Thank you for that. That was power pack, Nakia. Thank you for that.
You're
And you
welcome.
tell me, like, how long is it before a woman may see, and I know it varies from woman to woman or young girl to young girl, but how long does it take for a woman to get some type of like relief when she's coming and dealing with her symptoms?
It does vary, honestly, from woman to woman. What I do find is that typically, depending on what herb is being used, usually 2 to 4 weeks. In some cases, it can be up to 8 weeks. But I do find, especially with the hormone balancing herbs, a lot of them, usually around that 4 week mark, it just takes a while to fully get into your system. If you're taking it, let's say if you're taking something orally, this is why V steaming is so amazing, because really it gets into your bloodstream at a rapid rate. And then from there, we can decide whether we're doing any type of microdosing, whether that's from supplement or whether that's from tea or tincture form.
How
Mhm.
often should they come in for bee steaming?
For V steaming, depending on what they're steaming for, that can be 2 to 4 times per month.
Nice.
And typically that's on like a 60 or 90-day plan. And then from there, pretty much once a month just for maintenance. I look to really get to the nitty gritty and help the issue literally within the first 30 to 60 days. And then from there, it's just pretty much maintenance.
That's awesome.
Mhm.
Could you please give us your social media handle so everybody can go and look you up and come and see you? Ladies, please go and see Nakea because I know you need to. So go and see her and get taken care of. And also, if you have your website, if you can give all your information so they know where to come to.
Certainly. So our website is www.vtoxyourbox.com. And that's VTOXYOURBOX.com. That's where you can find Vtox Intimate Health and Wellness. We're also on social media under Vtox Body, VTOXBODY. We have Facebook, we have Instagram, and we also have TikTok as well.
Thank you
And
so
you can do free consultations too via phone.
much.
Yeah.
You can schedule those right on the website. If you're not quite ready to come in just yet and you just want to have a conversation about how it goes. Some
Love that.
people may not realize this is a pain free treatment, it is a relaxing treatment. Our office is cozy. I've set it up like a girl cave. You can come
Yep.
in and drink some
Beautiful.
tea,
Yes.
listen to whatever music you want to listen to. I make it more of a spa service, even though it is a medicinal situation.
Definitely an experience. It's beautiful. Your place is gorgeous and it really makes you feel like a girly girl when you go in there.
Thank you.
Can we,
Thank you.
can we just take a moment for Nakia's wittiness? Because she has created all of these like really fun words. Like
Yes,
one of my favorites is Vagician.
I know.
And
When she came on,
and
I
I
said,
can
"Oh, I'm
speak
the lady
on
tradition."
the experience as well. Like her space in Philadelphia is very like warm, welcoming, girly. Like I went for a treatment myself and it was wonderful. Like offering me teas and water and just like the whole experience is immaculate. And I'm so glad there's that option. Like there's something for everyone out there. So like if
That's
you prefer more of that holistic medicinal type, like Nikki is your person. And then like there are also like the other options too. And it just depends on people's desires, like what they prefer, their
Mhm,
budget, their
mhm.
time. So like there's a lot out there for perimenopause, menopausal
we
health.
have options. We have
And
options.
everything is customized in the office depending on
Yeah.
what a person needs. And
Yes.
even if like there are ways to like I was hot flashes were trying to take me out 2 years ago.
Yeah.
But I have been able to manage my hot flashes simply by using, and people do have to figure out what combination works for their body. But I do evening primrose in my belly button,
Mhm.
and I drink sage tea just maybe twice a week. And
Nice.
that has really helped me manage the hot flashes.
Wow.
However, someone else, they may need a different combination of things, right? So I have some clients that the evening primrose isn't quite enough for them. So their routine may be more of a black cohosh
Yeah.
or a red clover blossom,
Yes.
or the sage tea works well for them, or even a little sage essential oil with a carrier oil just kind of right into the belly button.
Right.
So these are things like there's different ways for herbs to be introduced to the body. So if a person is not comfortable necessarily with steaming, they may decide to use a different delivery method,
Yes.
and that's
That's
okay too.
great. Yes, that's awesome. And I like to say in menopause, we need in all phases of menopause, we need a toolbox. Because like you said, there's not just this one thing that's going to do it. You need to understand what's going to work for you, and that is what you need. What might
Hmm.
work for you might not work for the next person.
Hmm.
And it's never just one thing for me. I have like multiple things that I use maybe at different times. I gotta switch stuff up. So
Mhm.
we just gotta again be in tune with our bodies. I want to also, I know we can go on and on, but we are all busy. But I wanted to just bring up Nakea, you said that you started doing this out of, the need for yourself and your daughter first. And that is like one of the many things that the three of us have in common. We
Yeah.
created our businesses out of a need for, ourself first, and
Mm-hmm.
to a
Hmm.
love and a passion, because we were really self-serving, for our benefit and for our health first. So I love that. Dr. Victoria, with that, I'm gonna roll to you. Um, please tell me how you got started with Restore Physical Therapy.
Yeah.
Just a little bit about yourself. We're going to close out with you today. Um,
Okay.
but yes, we need to get that part on this episode.
It is a story. So I had I would say a decade of pelvic floor problems in my teens and 20s. Like I was having pain with tampon insertion and intercourse was not even a thought. I had like this horrible, it felt like sciatic pain at the time, but it was really like pelvic floor nerve pain, pudendal nerve. Um, and it just kept snowballing into worse and worse things. I would go to the medical doctor and they'd be like, you just have to lose weight. Like you're overweight. You just need to do it. And they offered me like the weight loss drugs and everything. I'm like, I feel like that's not the problem. And so I was talking to my friend from PT school and she's like, V, like I went to a pelvic floor physical therapist and it changed my life. I had similar things to you. I'm like, how about that? Like I didn't even think about it. Like we didn't learn much about it in school. I was an orthopedic physical therapist at the time, seeing like knees, necks, whatever, balance. So I went to pelvic floor PT, and in a few sessions, it cleared up about 85% of the problems I was having and more. And the rest of it was just like a back issue that I was able to get a hold of. So that inspired me. I'm like, wow, I wonder how many other people have been dealing with things like me for as long as I have and didn't realize it was the pelvic floor that was the problem. So that I took the courses, started offering it at the orthopedic place I was working at, and quickly realized like those big box PT places were not the best place for that care. So I was seeing multiple patients at once. It was a mess. So I decided to start my own practice where I could treat people one on one, give them space to talk and learn about their whole history, learn about their entire body, like not just the pelvic floor, but like what's around it. Because everything, like your back plays a role in the pelvic floor, your hip health, your habits, like what you're eating, drinking, your exercise habits, like all those things play a role. So like we needed to create a situation where people had time and space to talk to you, and also trauma. Like people have gone through trauma to the pelvis. Um, so like making a safe space for that conversation if they were comfortable. So I went around on the main line in Philadelphia with my little table and my car. I was doing home visits. Found a gym in Manayunk that was super welcoming and supportive of what I was doing, and found my home there. I've been there for 4 years on Leverington Avenue in Manayunk, and it's been great. And we actually have grown to 4 offices now, but
Hey,
that's a different story.
congratulations.
Thank you. But I was realizing, particularly with the postpartum population, like some people were in great shape, some people were not in great shape. So I wanted to learn, how can we have more people in better shape? So I went on to get my doula certification, a birth doula, so I could see like what the biomechanics were, what was happening in that delivery room, and like how can I help prevent some of these things? Because honestly, like postpartum is similar to perimenopause with hormones shifts. But we help people get strong through their pregnancy, learn about their hip and pelvic floor health. In the third trimester, we're teaching them how to use movements and body biomechanics to help that baby rotate and drop a little bit better so they don't have the tearing, they don't have the injuries from birth. And so their recovery is much better. The people that we work with during their pregnancy come back postpartum maybe a few times, if that. Like they're in much better shape. They're able to take care of their child. Um their partners, spouses are also in much better shape too. Some of them come to see us too, but um, they're in much better shape. Like the whole family's just feeling better. And that's what we're about. Like listening to the whole story, looking at multiple places, not just zoning in on one place, and really getting to the root cause of what's going on so people actually get better. And like, if you've ever been to PT before, like in the network big box place, you're asked to come like 2 or 3 times a week for 12 weeks or more. Like I've known people that are going for years and they haven't gotten better, but the insurance pays for it.
Right.
Whereas like if you came to see our practice one-on-one, you might have like 6 to 8 visits total, and they could be like once a week, once every other week. Um, so it's just kind of like knowing what your options are, knowing what your insurance benefits are, what works best for you. Um, but it's surprising, like, I don't want to go too deep into this, but I saw on a local Facebook page somebody took the leap to go to pelvic floor PT, went to a big box insurance place, and the insurance billed them $500 for one session. And that's like makes me so upset because like people are trying to do what's best for their family and use their insurance if they have to, but then get stuck with that huge bill anyway.
Right.
And that's what we try to avoid too, is like our prices are transparent. You know what you're paying. You're not going to get a surprise bill. You might actually get money back by your insurance company. So just like I said, every situation's different. You got to do what's best for you, but there are different options for care.
I love it. And I love talking to both of you ladies. It's the care that you give and the compassion and the understanding and just showing up for, your clients. Like again, we need that like 10 times over. Dr. Victoria, can you tell briefly like how women in menopause, how they can benefit from pelvic floor therapy?
Yeah. So you'll come in and get that eval. We'll learn about your history, if you're taking any supplements, if you're taking any meds. Um, I have a questionnaire that will tell me like if things are off a bit with hormones or habits. But then we're looking at everything. So I'm looking at your spine health, your hips, pelvic floor, lower extremities, and watching how you move, testing your strength, testing your mobility, joint mobility. We do a pelvic floor exam if you're comfortable. So that can be either external, internal. Internal involves a gloved finger with lubricant into the vaginal canal to assess those muscles very directly. And from there, we can tell if you're tight or weak. We can tell if you need more endurance or more power in the pelvic floor. We incorporate that stuff into your functional movement patterns and really like cater it to what you need. Like if somebody wants to run a marathon, we try to get you to that. If you just want to be able to work with your kids, or like play with your kids, like we get you to that point. Like it depends on what your goal is.
Yes. Well, I know my experience was amazing. I think that we lost Nakea, but
Sorry, she's a busy lady.
she is a busy lady. But Dr. Victoria, I thank you for everything that you do to serve because every single day you waking up, you serve. I watch you, I see your social media, and you are a badass. You're strong. You lifting. I'm like, goodness gracious, talking about strength of a woman.
What Cheryl's talking about is I'm a female competitor in the strongman sport, so it's so much fun. It's crazy, but it's fun.
Ladies, we can do it all. We
Yeah.
can do it all. It's been proven. Go to her page. Dr. Victoria, please tell the audience where they can find you, your website, and you are on the Pretty Moody website under our experts
Oh,
tab.
thank you.
Yes.
And we have you on our referral sheet as well. But
You.
Um, we're in Philadelphia, so we're in the Philly proper, but also a couple suburb locations. And then our website is www.restorethefloorpt.com. So it's easy to remember. My handle's the same. I can't speak.
It's
Restore the Floor Doc on Instagram, and then we are Restore PT Philly as well. Like that's the business page. We also do free consultation calls. So if you're not sure if pelvic floor PT is right for you, we can talk you through it. If you need to see somebody else instead of PT, we have a vast list of referral sources that we can send you to.
Thank you so much. As always, it is truly a pleasure to have you on, dropping some knowledge and love to the Pretty Moody community. Thank you for coming on Hot AF. This was
Yeah,
definitely a Hot AF conversation today, and it's Women's Health Week. So,
it is. Perfect.
yes,
Glad we did this.
so pretty. It's Women's Health Week. So, ladies, enjoy this full episode. Go and see Dr. Victoria. Give her a call. We deal with a lot of things that we can fix by getting some pelvic floor PT and menopause. Dr. Victoria, I love you. I thank you for being on again. And I cannot wait for us to have our next conversation. Thank you.
Thank you.
Yes.